Well, the state and federal government are working to make testing for COVID-19 possible nationwide. Today, Hidalgo County announced state tests were sent to a lab in Harlingen.
Yeah, these tests are also available right now in the private sector. Valerie Gonzalez in our newsroom. And Valerie, what should people do if they think they have symptoms?
In order to get the test done right now, you have to pass two standards. First, you must meet certain criteria. You will be asked if you have traveled to a high-risk country or area of the United States, have come into contact with a person confirmed with COVID-19, or are symptomatic, including respiratory issues. Doctors are being asked to conduct respiratory panel assessments that will help rule out other illnesses with similar symptoms. Aside from the state labs, people can get tested by going to doctors working with certain labs. You will face a similar process. Access to COVID-19 tests is already locally possible. Channel 5 News confirmed Quest Labs began working with cooperating physicians nationwide on Wednesday. In a statement, they said providers anywhere in the U.S. are now able to order the new test service. We are also scaling capacity now with the aim to validate and perform testing at other Quest Diagnostics high-complexity laboratories serving the United States. We expect to be able to perform tens of thousands of tests a week within the next 6 weeks. This is now available in the Valley and not just by Quest. We spoke to a clinical director of the Family Practice Center in McAllen.
On Monday, one of the big laboratories in the Valley that is called CTL sent us 10 kits to make the collection of the specimen. And today we receive another 10 kits from Quest.
This testing is only going to be used for cases that go through a protocol.
This kit, they recommend for us to use only in patients that the provider discretion think they are high risk.
Patients who suspect they have COVID-19 symptoms will be passed into a separate waiting area. A provider will ask them questions to know whether they've been in a high-risk area, near someone who is sick with COVID-19, or if they themselves have associated symptoms. If the answer is yes to any of those questions, the office will issue a respiratory panel assessment.
That's one of the tests that we do here in order to rule out any other virus that is causing the patient's symptoms, not related with the COVID-19.
If they rule out illnesses like flu, pharyngitis, or strep, the doctor determines if they're a high-risk or low-risk case. A low risk will be put in self-quarantine, and the doctor's office will monitor their progress.
Usually the virus problem is going to go away after 5 to 7 days. Everything is going to start going down. If that's not the case, then the patients from low risk probably is going to go to a high risk patient, and then we need to test for the COVID-19.
They already had 5 people come into their office so far. The cases turned out to be flu or strep. They have not had to use the COVID-19 tests as of yet. When a private lab runs a test and it is positive for COVID-19, it is then determined to be a presumptive case. That's according to the Hidalgo County Health Department Director, Eddie Olivares. That presumptive case is then tested by the state and CDC to be confirmed through them. Olivares said there should not be any on-demand testing right now for people who do not meet the criteria described earlier. Otherwise, that can create a backlog for the state's testing of people who did have symptoms for COVID-19. In the newsroom, Valerie Gonzalez, Channel 5 News at 6.